And now you have naltrexone in you
Mhm.
that will save you for 4 months of agony.
And optionality is key when you're looking for help in the addiction treatment world.
Hi, friends. My name is Pej. I'm an interventionist. I specialize in helping people with drug addiction, alcoholism, and mental health. I try to help them find their lives. Sometimes I have to help people get the help that they need as far as detoxing too. Today we're going to talk about rapid detox. I have a little bit of experience with this, but they have a lot more experience with this. I have my friend here, Anushka DeGiorgio, right?
Mm-hmm.
And Dr. Andre Aboulian. And I will go ahead and give it over to you guys, and you guys can talk about all of this.
Thank you. Thank you so much, Pej. I've known Pej for some years now, and we've come across each other professionally and also built a nice friendship through our desire to help people who are struggling to overcome problems with mental health, substance use disorder, and trauma. Rapid medical detox is something that I didn't know anything about, but I found out about it because I was observing in my 11 years of working with addicts that people with opioid addiction have options available to them for detox that take a lot of time. So if you want to go to detox, you usually go to a residential facility. You stay there for sometimes several weeks. You can experience very painful withdrawal symptoms that can be physical, emotional, physically excruciatingly painful. You can also experience becoming addicted to benzos because the benzos are prescribed to mitigate the withdrawal symptoms that are so painful. So when I met Dr. Aboulian many years ago, we started talking about this potential option of rapid medical detox that I had heard about. And what it consists of is shortening the time and completely eliminating the pain of detoxing from opioids. And I'm going to let Dr. Aboulian talk to you a little bit more about what the process is and how it works.
Thank you, Anushka. Thank you, Paige. So what we do with rapid detoxing is we actually take patients to the operating room. We put them to sleep. And the reason for that is we don't want them to feel or experience any of the symptoms or the pains of detox. And while they're asleep, we'll introduce a medication called naltrexone, which has been used in medicine for a long time. It is an antagonist of opioids. So basically, naltrexone occupies all the receptors in the body that otherwise the opioids would occupy, and therefore, or if you have opioids in you, it will kick the opioids off the receptors. So now naltrexone occupies the receptors, and they stay there for a good 4 months. So basically, while you're asleep, you're going to go through the physical detox symptoms, but you're not going to be aware of it. And this can take anywhere from 4 hours to sometimes 8 hours. And we know when you're done with the symptoms, because when your heart rate comes down, your blood pressure comes down, all the physical symptoms of a detox basically go back to normal. That's when we choose to wake you up. And now you have naltrexone in you that will save you for 4 months of agony.
Absolutely. This process I found to be revolutionary in this field because I see addicts who don't want to detox because they don't want to go through the pain or they don't have time to spend weeks in a detox facility, right? The other options that are available to opioid addicts are getting put on some kind of maintenance drug like Suboxone, like methadone, and Paige would be able to speak to this as well. We've had a lot of experience of patients and clients who get put on these medications. And although, yes, it's true, they're not actively using the opioid that they came in with the problem with, they're now on a medication that causes them physical problems, causes them like stomach problems, gut problems, slows everything down, makes them uncomfortable, but even more importantly, it sedates them to the point where they can't do meaningful cognitive therapy. They can't really participate in actively improving their lives and learning tools because they're sedated. And for me, rapid medical detox from opioids just really gives us another option. And optionality is key when you're looking for help in the addiction treatment world. We want to make sure that you get the best options that are available to you, that you know what your choices are. That's why people like Paige are so important, because interventionists are at the front line of people who are seeking help. So Pej has all these different options available, and he can screen people and his clients so that he can see what's the best option so that the patient and the patient's family can choose. So that's kind of what we're trying to do here. We're trying to create lasting and good change in this area. And if you would like to know more, please reach out to Pej and he'll put you in contact with us.
Yes, if you've gone to treatment several times, you've been to long-term detoxes and residential treatment stays, and it hasn't worked out for you, and you're interested in learning more about Rapid Detox, I would love to be able to plug you in with them. They are out of Beverly Hills, California. You can contact me, and I'll put you directly in contact with them. My number is 310-596-9356. My name is Pej, the interventionist. Thank you both for coming out today.
Thank you.
Thank you. Thank you, guys.